All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, your community pharmacist. Also wanted to just announce, every caller on this show tonight, you will get a free gallon of Kangen alkaline water. So make sure you come in. I've got the list here of who all called. Come into the store and get a free gallon of Kangen water. All the callers tonight. We're going to get right back into your calls. We've got Thelma on line 4. Welcome to Pharmacist on Call. How may we help you?
Hello, Dr. Pruitt.
How you doing?
Well, first of all, I want to thank you for your very thoughtful remembrance of our precious Pootie. And also, thank you for letting everybody know that I have another birthday coming up, which, by God's grace, I'll be very happy to celebrate with you all. Thank you, sir. I have a couple of questions.
Yes, ma'am.
The first one is, does your weight have anything to do with the amount of beetroot juice? If you lose, say, a lot of weight, maybe in say a week or two, should you adjust your dose of the beetroot juice accordingly, or does it not have any negative effects regarding weight?
Interesting question. Actually, no. So beetroot juice's effects are on, other than hypertension and diabetes, it also lowers cholesterol. You will probably lose some weight because it is high in fiber and it's going to clean out your guts. So you're not really going for a weight loss benefit for beetroot juice. You're going for the health therapeutic benefit. So weight loss won't play any role. You're trying to use it to lower your blood pressure, your cholesterol, and your blood sugar.
Right.
So your weight won't play any role in it. You'll still take that capful once or twice a day because you're not going for the weight loss piece. You want your hypertension to stay, in check. You want your A1C and your fasting blood sugar to stay in check. And that doesn't, so your weight doesn't matter.
Okay. And I don't have to be concerned about the taking the amount twice a day or anything like that.
Well, it only matters if, say, you wow, I noticed that my blood pressure did go down some, but I really wanted to go down closer to normal. Then you would add on a second dose in the afternoon on an empty stomach. And I have a number of patients, even Linda said that she's added on a second dose and it kept her blood sugars in check while she was in Texas. So if you've noticed that it's getting you down, but you think you could do a little bit better, then add a second dose of the beetroot juice. But again, nothing tied to weight.
Goodness, I have a full bottle put back. Well, thank you. And I also wanted to know if there is any difference in the Lydia Pinkham pills and the liquid formula.
Dosage-wise, no, but I think the liquid you're going to absorb easier.
Okay,
so
that's what I was wondering, if it could maybe be absorbed easier and quicker.
Yes, ma'am.
All right, then. Well, that answers both my questions. Thank you so much for what you're doing.
Yes, ma'am.
And being a stand-up doctor for our community. And I'll be sure and come in and get my free jug of Kangen water.
Yes, ma'am.
As soon as possible.
Yes, ma'am.
Thank you, Dr. Pruitt.
All right, thank you. All righty, bye-bye.
Bye-bye.
All right. Yeah, the loss has been a really tough one on my mother, so certainly praying for her as well. All right, gonna dig on line 5. Carolyn, welcome to Pharmacist on Call. How may we help you?
Yes, sir. I would like to know what you know about idiopathic pulmonary fibrosis.
Idiopathic pulmonary fibrosis. Idiopathic meaning it has a cause that we don't know how the heck this came to be. Pulmonary fibrosis is a hardening of the lungs. Sounds like cystic fibrosis, but I know very little about it.
Okay. Well, I have been diagnosed with it, and I have been on OFEV.
Yes, ma'am.
Do you know that?
No, ma'am. Do you know, is there a generic name or a chemical name for it?
Oh, no, sir. And it's NINTEDANIB.
Okay, so that sounds like
a specialty drug.
Yeah,
really
monoclonal.
Very expensive.
Yeah, monoclonal antibody. Okay. So I take it these are injections?
No, it's capsules.
Okay.
I'm taking 150 milligrams twice a day.
Well, I mean, you're going to make me learn something new, so now I've got to look this up and be ready for next month.
Oh, okay. Well, I was just wanting to know if you knew anything new that you could tell me about it or whatever.
No, ma'am. Give me one episode, and I'll be ready for February show.
Okay. I sure do appreciate it.
All right. Thank you, ma'am.
Yes, sir. Thank you.
All righty.
Bye-bye.
All right. Bye-bye. Okay. Line 1, Angela. Welcome to Pharmacist-on-Call. How may we help you?
Oh, yes, Dr. Pruitt. I'd like to know if lisinopril, if you've been taking it for a long period of time, does it make you cough? And also, can you lose your muscle mass?
Okay, so 2 major side effects with lisinopril. That cough is the number one. It is a very irritating cough. It's a dry cough as well. And then, of course, the second is angioedema, which is a pretty serious side effect. But yes, ma'am, that cough is tied to lisinopril. Actually, that whole class of drugs. So benazepril, lisinopril, all the prils.
Oh, okay. And also, is it not good for black?
African Americans?
Yes, African Americans.
Well, in my practice, I see the majority of my patients are on it. So I think that the research has shown that we actually respond pretty well to ACE inhibitors. But let me double check that.
Okay. Because I'd like to know an alternative, what I could take instead of that.
What's your blood pressure running?
It runs, I'd say, anywhere from like 140 over 90.
Okay. I think you're a good candidate for beetroot juice.
Oh, okay.
So what we can do is, I want you to continue to take your lisinopril. You're going to add the beetroot juice on 1 cap in the morning on an empty stomach, and maybe 1 in the afternoon, so that we get a really good result. So when you go see your doctor, over time, they're going to be like, you know what? Looks like your blood pressure's lowering. Let's kind of back off on that dose a little bit. And you will keep taking the juice until they say, you know what? I don't think you need this blood pressure medicine anymore. So like what the ACE inhibitor, the lisinopril, does 2 things. A, it does lower your blood pressure, but it also has a kidney protective effect, especially if you're a diabetic. Are you diabetic by chance?
Yes, sir.
Okay, so that's the reason that you're put on that, because they've also shown that, you can decrease morbidity, mortality, particularly with diabetics. Those will also have kidney disease as well. It slows the progression of kidney disease in diabetics, but the beetroot juice also has a kidney protective effect as well. So, as well as helping you with your diabetes, so not only will you get lowering of your blood pressure, you will get your A1C and your fasting blood sugar lower as well. So let's do it on top of your medication. Don't stop taking your medication. We want your doctor to make that decision because they're going to see you getting better. And this is the case with all of my patients who take, their medications. You're going to get down to the point where they're going to continue to lower your medication, and then you're going to come off of it. But you're going to have to keep taking the beetroot juice because you do still have hypertension and diabetes. You follow me?
Right. Yes, I do.
Yeah. So if you want to come off of the ACE inhibitor with that annoying cough, but something you could do immediately. I think the class after the ACE inhibitors, which are the AT2 inhibitors, I think you have less of an effect with a cough. So things like losartan, valsartan, those may also be good candidates for you as well if you're trying to avoid the coughing side effect. So you could ask your doctor about those drugs as well.
Okay, well, what about the muscle mass?
The muscle mass, I don't think it has an effect on, but I can look that up.
Okay. All right. And it's good when you take in metformin and things like that.
Metformin helps with the diabetes, so it works in 2 or 3 different ways. First of all, it slows down the amount of sugar that your liver is kicking out. It also encourages your muscles to suck up whatever sugar that that's circulating in your bloodstream. So it has a sugar uptake mechanism, and then it slows the production of sugar, glucose, from your liver.
All right. right, because I was also diagnosed with neuropathy.
Well, what that is, the neuropathy is a byproduct of your blood sugar being out of control sometimes. So if you find that when your sugar is the highest, that you notice that numbness and tingling, particularly in your fingertips or in your feet, it'll be like a burning, itching kind of feeling. Mm-hmm. Yeah, so that's peripheral neuropathy, which is common in diabetics. And sometimes if your sugar is out of whack, you may even notice something called gastroparesis. Actually, with my late sister suffered from a fullness in your stomach. You notice your stomach will be really tight. You won't be able to eat as much as you used to, kind of nauseated. So a lot of side effects from your blood sugar kind of being out of whack. So that's why it's important for diabetics to keep their sugars under control, because it's more than just having a high blood sugar. You're having your kidneys being attacked, you're having gastroparesis, on the GI side, and then you're having peripheral neuropathy, the numbness and the tingling. So it's very important to keep your blood sugar in check.
Yes, sir.
Mm-hmm.
All right, well, I appreciate it, and thank you.
Yes, ma'am. All right, thank you.
All right, bye-bye.
All right, bye-bye. Okay, looks like we lost one. All right, Ricky on line 3. Welcome to Pharmacist-on-call. How may we help you?
Yes, I'm Ricky, and I'm a diabetic. And I've had a little lower back pains, and they go down my legs. And it's sort of like a muscle-like jumpness in my leg. And it have started going like in my fingers getting numb, and it goes up like to my forearm with my elbow.
All right, you said you're diabetic?
I am.
Okay. All right, so yeah, that sounds like neuropathy, but you may have 2 causes. So one, you're going to have it in your periphery because of diabetes, but the other piece is you may have something going on in your back. So especially when you're telling me about the traveling pain, so it feel like it's coming from like shooting down your leg. Is that what you're telling me?
Yeah, it's moving down my leg, and as it go down my legs, in my legs you can feel like a muscle movement.
Okay.
Jumping like sensation, and it does that a while. It aches, and it'll leave. But here recently, it have moved to my fingertips and my finger, and they get numb, and it feels just like it's not, poor circulation in them like.
Well, yeah. So what do your blood sugars normally run?
Well, my blood sugars have been pretty good. They run like 130, 150, somewhere along in there.
Okay. We'll probably get a little bit tighter control, keep it around 120 or so. Do you do like a 2 hours postprandial, like 2 hours after you've eaten, to check your blood sugar?
I check them before and after.
Okay. And then after you eat, what does your blood sugar look like?
Okay, after I've ate, it maybe get up to like 160, like that, somewhere along in that range.
Not bad. Okay. But yeah, it's just a byproduct of the condition. So you probably notice it in situations where you're stressed or you're sick, you're getting over a cold or something like that, because that pushes your blood sugar up. But again, I think that in addition to the diabetes, you may have something going on with your back. Maybe a nerve is being compressed. Have you had any issues with your back ever?
No, I haven't.
Okay.
I've really had any issue with my back.
Okay.
But the same pain that hits my back is like it have got in my fingertips. Like a numbness sensation.
Yeah.
And I looked the other day, they act like my fingers, like they got a little swole. So, it's hard for me moving my fingers back and forth. And it's here lately, it have got going up like close to my elbow.
Yeah, that's neuropathy. I would ask your doctor to maybe take a look at your back, and maybe they could do an x-ray and make sure no nerves are being compressed.
Okay.
Because that can cause it.
Okay. So is it anything good for this numbness in my finger?
Whoever comes up with a cure for neuropathy will be a billionaire, because it is the #1 complaint on this show in the 3 seasons that I've been doing it, and no one has a solution for it. Now we have some like topical compound creams that will help, some, but in terms of taking it away altogether, no.
Okay.
Yeah.
Now, is there any kind of supplement that I can take as a diabetic for bones and, for like some supplement?
Your bones, meaning to strengthen them?
Uh-huh.
Oscal D.
Okay.
Yeah.
So that wouldn't interfere with my diabetes or anything like that?
No, sir. Yeah, it's calcium with vitamin D.
Okay. Okay, and you say the name of it is?
Oscal, or it's calcium carbonate with vitamin D.
Okay. All right, I appreciate it.
Yes, sir. All right, thank you for your call.
Thank you.
All righty. All right, let's see where we are here. Caller, welcome to Pharmacist-on-Call. How may we help you?
Hello.
Hello, ma'am. Welcome to Pharmacist-on-Call. How may we help you?
Thank you. I was calling to inquire. I'm also a diabetic,
Yes, ma'am.
and I do have neuropathy.
Okay.
I fell, and now it damaged my sciatic nerve.
Okay. Hello, ma'am. Could I get you to hold on? We're up on a commercial break. Can you hang on for a couple of minutes?
Sure.
Okay. All right. Everyone, we will be right back, and we're going to finish this call.
All right.